I hope all our folks online can see us. Good. Good. They know you're here, right here. All right. So, welcome to our Research Understand Systems for Housing, what we call RUSH. Thomas Patton.
Trace Rollins.
Got slides. Yeah, get about that. Go on slides. I'm Thomas Cotton. I'm the founder and CEO of Redemption and Advancement Alliance, which is a nonprofit that originally focuses on reentry, but we also look at fatherhood and challenges and symptoms they face. And so we're going to present on our, you can probably do this and I can do this. We're going to present on some findings that we have and some challenges that we have for fathers. But along with that, we are going to talk about some solutions that we're going to work on. And so I apologize. I want to turn the waiting room off, but there's no way of doing that. So got to go with what we have. Okay. Open. I keep trying to turn the volume off from that. So.
We appreciate you all being here. Sitting so far in the back. Like we don't have cookies for real. Like you all can be close, but at any rate, let's try the announcement.
So we had it nicely set up all before you everybody came in. Changed it.
Okay. And so that's me, Latrice Rollins, and you all can read that in terms of who I am. You can look at the bio and the HOVA app or HOVA app. But I think what most people want to know when they meet me is why do I do fatherhood? Why am I engaged and so passionate about engaging fathers? And beyond being daddy's girl, uncle's girl, granddaddy's girl, beyond all of that, personal experience is my professional experience, particularly working in the child support system, learning that there are a lot of biases and a lot of systems and resources that are not available and open to fathers. So with that experience with the child support system, it helped me to just really not help, but it kind of sparked this passion to make sure that services are equitable and that resources are available to every parent to be in a position to contribute to their child's life in the way that they want to, in the ways that I've had a lot of positive men in my life contribute to me. I think every child should have that opportunity. And so we also have a team member, Lisa Yeoman. She's not here today, but she is a part of our RUSH project team as project coordinator. Also a strong advocate for fathers. She has a conference coming up called We Are Still Kings. And so you can look at wearestillkings.org and see the registration and all of that information. I want to give her a great shout out. And so, as Thomas said, we are going to talk about the RUSH project. We're going to describe the prevalence of Black fathers who are experiencing homelessness nationally, as well as in Atlanta, where we are. We're going to talk about the community-based participatory research approach, as well as this EPIS framework, which is used for implementation science, how you basically understand why and how a intervention is successful. We're going to look at a systems alignment approach called Functional Zero, which is aiming at addressing homelessness, and we're going to use it in this case to address homelessness among Black fathers. We'll talk about some of the barriers and facilitators to addressing homelessness, as well as talk about some of the preliminary findings of our study.
And if you haven't hit the sign-in form, there's a link for you. If you haven't, we'll make sure we capture everyone's data or information so it stays connected.
All right, so I just want to share with you a bit of background of our group called Fathers Matter ATL. This is another QR code if you want more information about Fathers Matter ATL, but it's a community mobilization approach that was actually initiated by the National Fatherhood Initiative to help communities come together, multi-sector partnerships for folks to come together to promote and support father engagement. And so we did this in Atlanta in 2021. During the pandemic, we were one of the first to actually do this approach virtually as opposed to getting together in person. We had a number of different leaders, about 180 leaders across different sectors, faith-based, academic, health and human services, education. All of us come together to figure out what each of us could do in our respective places to support and promote father engagement, because each of us can do something in the places where we are, especially if you work with children, especially if you work with families. And so instead of thinking of what we could do separately, we came up with 7 different strategies of how we can work together to promote and support father engagement. The image that you see on the right is what resulted from the brainstorming in the session that we had. And so coming up with this vision of how we were going to develop equitable systems that serve fathers. And one of the strategies, we have 7, one of the strategies is addressing mass incarceration, because that came up as a major issue that the leaders brought up in terms of barriers that needed to be addressed for fathers to have access to resources. And Thomas Cotton and Lisa Yeomans, they co-lead that strategy. So in doing that, they came across this issue around housing. And so I'll turn it over to Thomas if you not too fascinated with the technology to talk to us about.
Definitely not fascinated. Look for ways to turn this mess off.
Don't get us kicked out of conference. They want this to be.
I'm saying the binging and the ding.
Oh, it's not going. It's going bing.
It's going bing and it's going to ding.
It's going bing.
One of the things that we recognized as we started this process is that no, we're still not there. Can't see the screens. Is that there were challenges with fathers. We had an individual reach out to us. We're a group that has 40 organizations and individuals and across different strategies for fatherhood. And when this individual came to our knowledge, he had a child, he needed housing, they needed it immediately. And none of the organizations in the strategy could meet that need right away. And it was just one of those things where when we started looking at this, it was like, why couldn't we meet this need? And a lot of it has to do with the research we're going to talk about today. But then we found a way to find emergency housing. Then there we created a list that allowed us to have more resources that can potentially help them quickly. But then we started thinking about what are the long-term challenges to fathers. If there's a short-term challenge and 40 organizations couldn't meet this challenge, then what else could we do? And so we started thinking about how do we make sustainable change and transformation, not just emergency, not just in the moment, but the long-term sustainable. And so for our strategy, which is addressing mass incarceration, we began to look at different ways to do this. And then along the way, Robert Wood Johnson Foundation came up with a grant that allowed us to do some research and find out what are the barriers.
Yeah. So, I mean, we understand housing and transportation is an issue for a lot of people across the country. But like Thomas said, particularly dealing with fathers, we were running into, there were no resources available for this family that was having basically it was a father that had a child and they were staying in a car and they were trying to, figure out where can they go to get out. And we could not find a place that would take them, immediately. We eventually were able to help them, but to be able to find someone that says, we're doing housing, we have all these different initiatives, and for there to be nothing, we were like, what is really going on? Yes, we are able to eventually find something, but how do we understand these various systems and begin to make changes? Because we continue to hear there's additional funding for affordable housing, there's additional funding for homelessness prevention, et cetera, but we can't seem to connect and find a way to meet these dad's needs. So we wanted to do this research to really understand. So just to give you some background on the prevalence of this issue, particularly among Black fathers, if you all looked at the majority of African Americans make up 13% of the general population, but more than 40% of those experiencing homelessness. So that shows the disparity there. And although there are services and policies that are addressing homelessness in the United States, like I said, they continue to come up with more funding and things around us. Fathers tend to be that underserved subgroup in the population that every time we talk about this, I'm like, I didn't even think about that. And it's like, why not? Like, I mean, if anybody else is experiencing housing issues, fathers would be as well. So the research shows that most of the homeless population are men, and 41% of these men who are experiencing homelessness are in fact parents. A lot of times we see men and just see them as an individual. We don't understand that they're connected to families, they're connected to children, and we don't ask, or they don't ask if these men have children. Only about 60% of sheltered families include a father, and that's not because the father is not present, but a lot of times they're not allowed in those shelters. So as we know, single fathers are becoming one of the fastest growing populations in the country, and the number of single fathers has almost doubled from 1990 to 2020. So in 2022, when we looked at the Atlanta Homelessness Management Information System data to find out exactly, again, the prevalence of this issue among fathers in Atlanta, most of the fathers, 53%, were single fathers that were in their system, meaning they, engaged with their homelessness management information system, and the majority, 93%, were Black or African American. There's only one shelter in Atlanta that will take a father with children. So I'm going to give you a bit of background about our framework for how we basically work together and how we conducted this study. Community-based participatory research, or CBPR, is the process that we use, making sure that we engage individuals who are directly affected by an issue throughout the process, from planning what the research study is going to look like, developing the tools for data collection, understanding the findings, and sharing together what those findings were. So throughout the whole process, this is what we will use. And so it's important, this diagram or this figure is showing you all the different pieces that are contained in the CBPR approach. And it's so important to understand the context of the issue that you're dealing with. So looking at the social and structural issues, like I talked about, just kind of the greater landscape of folks focusing on homelessness and focus on housing issues. What are some of those policies that they have? So different policies that men can't be in certain shelters, and that there aren't a lot of shelters in Atlanta specifically for families, or not for men as well that have children. Looking at the partnership process. So a part of this particular opportunity is systems alignment. So we had to have, and I'll get into it later, but we had to have medical care, social services, and public health partners. And so having this multi-sector partnership, how does that kind of influence the research that we will do? We have to kind of build our structure around that. And so again, just the overall CPR has just been found to be more positive and more effective because you're engaging people from the beginning, all of your partners, people who are impacted by the research, you're involving them from the planning all the way to the sharing of the results.
I just want to say that CPR is something that, if you're in the community and you're a practitioner, really getting involved with the people who have they're nearest to the problem is important. When you have people that from the community that can speak into the work that you do, the research or the solutions, you have someone that's directly impacted. And so for myself, I'm from the community and started this work through community work. And as I engaged Morehouse School of Medicine through the Prevention Research Center, as a community member that guides the board, or it's called the Community Coalition Board. But we started jumping into what CBPR was. And when I finally started understanding the value, imagine the research that we get today. No one has done that research. A lot of times that research reaches back to our community 6, 7 years later. It's probably a little faster now, but it's still 5 years. Because no,
Probably more.
Probably more.
Double.
So knowing that, wouldn't it be better if we can get this research and get it back to our hands to really understand what's going on in our community within a year or two? And I mean, that's what CBPR allows us to do, is really connect with the community, have the direct access, do the research, find out what's going on, and deliver it back. And even this research that we're talking about right now is less than a year old. This is brand new research that you're going to see that there is a significant need for dads in housing. and we're able to present it right here, right now. And this is not the only way we're going to disseminate. There's many other ways that we can disseminate the findings that we have. If you don't have to wait for it to go through journal review or anything else, you can literally connect with it right away.
And part of having the partners involved in the work is, to Thomas's point, they're already learning what's happening. They're getting the research back to them so that they can make real-time changes to what they're doing in their processes and things like that. Don't have to wait for till the end of the study, or they don't have to wait for a journal or things like that to come out. And I have to wait for this presentation to be done. We've been working together throughout the year, so they're able to just see, okay, I wasn't aware of that. Let me go ahead and switch this and change it, because they're a part of the process from the beginning. The other model that we use is called the FFCA framework, and so this kind of speaks to the. It was working. It kind of speaks to understanding the context, right? And so FFCA stands for exploration, preparation, implementation, and sustainment. And so you're able to.
I am not trying to do that.
You're able to. I'm sorry, it's changing on us.
It's changing, yeah.
So you're able to basically understand what's the context for these various partners that we're working with. So in the medical care setting, how are they going about with intake and assessment and prioritizing, various issues of the patients that they are seeing, from the housing standpoint, from those social service partners. What are their processes? How are they prioritizing fathers or men? How do they collect data? So just really understanding what's happening with all of the partners. This particular framework kind of walks us through that, so that you can understand what were some of the ways that your particular intervention would be successful, or some ways that, or particular obstacles that may come up. So you're learning that on the front end and able to kind of prepare for it, and just kind of continue to monitor things as you're implementing the various things that are happening in the context of the situation. But sustainment is always the goal. We're not just doing research for research's sake. We want to make sure that the things that we find out that work, these partners are able to put them in place. So this is just a framework to kind of help us conduct the research.
If this works.
You want to try to do
The videos come out. We just kind of go through it and just this thing. Sorry about that. I'm way more tech savvy.
the problem is I'm pressing and you're pressing. So
Well, it's not has to be on the screen to press. That's the problem. So let me get to the screen. Let me get to the screen. So we need to select that screen over there. So we'll work it out. All right. So I need to get it back on to this screen right here. All right, there we go. Functional zero, and it's a mess up here. Sorry about that. So the functional zero and absolute zero, these are systems, these are approaches that we're doing. So when we think about functional zero versus absolute zero, functional zero is maintaining a zero homeless population. And so it's a system that allows us to go through a process that for some months that a person is going through a whole process. And so, when you think about the process, it's identifying levels that this person is engaging in homelessness. So what are the challenges, and meeting those challenges and the needs that they have, and then bridging innovative strategies to help this person to achieve a functional zero, meaning they're off the streets, they go to emergency housing quarters, so to speak, and then they go through some different programming that helps them to get in position for housing. Once they get in position for this housing, then how do we get them to a point where they are not experiencing housing homelessness again, but have permanent housing? And so once that person goes through this process and they've been off the streets for a certain period of time, that's what the functional zero approach is. It doesn't mean zero homelessness. It just means this person hasn't experienced homelessness for a period of time, and they're moving into a more permanent space. So when we think about, quickly accessing resources and needed supports, what are some type of supports that you think that fathers who are homeless and custodial with their children what type of resources do you think they'll need immediately?
That's
Head Start,
childcare.
childcare, okay,
Food.
food, yeah. Sign up for Medicaid, Medicare, services for that. Employment, transportation, childcare, we have stable employment, there's people in chat, so it's good. Um, one of the things that we often know that they need all these things, but the housing aspect is first, and we'll talk a little bit more about that. When you start thinking about the functional zero, person-centered, data-driven approach, so we know this person, we're going to talk about the finding list coming up, but it's allowing the person to go through a system that gets them to a point where it's a non-recurring experience. That's a functional zero approach, a non-recurring experience. So it's like a person going to jail or prison, they get out and they stay moving forward. It's like a drug user or alcoholic that goes through and they work their system and they no longer relapse into anything. And so the functional zero is something that the unhoused person doesn't relapse into the same spaces.
This is an approach that's been used in about 7 different communities. It was created in Canada, but it's been used in different communities in the United States, looking at veterans, looking at other kind of populations. And so we wanted to use the same approach, specifically focusing on Black fathers in Atlanta.
And so when you think about person-centered, that's important because a lot of times we get system-centered. And when we start thinking about systems, centering systems around individuals, we miss individual needs. So individual needs have to be at the forefront of the data of what's required. And so, as Dr. Rollins said, there's 7 different communities where they achieve functional zero. And it's not just for the people who are just regular people. We can think about veterans. There's veteran groups, there's different groups that find themselves in different challenges, different situations. And so, housing needs need to be addressed in order for the individual to really feel stable and move forward. So as we're looking at functional zero, this is the method that we're looking at. I'm sorry, it's just one of those things. One of the keys to success of the functional zero approach has been because the model is shared with direction, ownership, and testing of actions in homelessness. So there's a shared model that we have. It's about knowing the names and the needs of every person experiencing homelessness. And so when we're working towards this homeless thing, there has to be a multiple response. It can't just be an individual response. And we'll talk about a system coming up that we use so we can have this multi-level response. Feel me? Actually, that's it. It just went away. The video's coming up after this.
Okay. So one of the key factors and critical factors of a functional zero approach is this by name list. A lot of times, with a coordinated entry process, people are they're coming in, they're filling out paperwork, they're kind of going through the system. But this by name list allows you to understand the person more intimately, understand this person's name, this person's particular needs, what actually caused the homelessness, so that you can get to the root of an issue and continue to make that person a part of the community, a part of figuring out and kind of tracking what's going on with them. So it's not just a one time come in and you fill out some paperwork and get referred somewhere, but you are, with this functional zero approach, you're watching the flow of activity. So they're coming into the system or into your intake process or whatever. You're assessing, you're referring, but you're still keeping in touch and making sure that, okay, all needs are met so that this person isn't going back into this cycle of homelessness. And so it's important for us to understand who are the fathers in our community. Remembering back to the Fathers Matter ATL, the group that we have of providers and different agencies who are partnering together, working with fathers, having them to let us know these are dads in my program or dads in our communities who are experiencing homelessness. The medical care partners that we have, the public health partners that we have, letting them share with us, hey, this dad came into the clinic today, and giving us his name and his information so that we can start to work with them and understand, how we can best assist. So it's a process, but this by name list is critical for us to, know those individuals and be able to continue to stay in touch with them to make sure that they're not flowing back into their situation.
Nice.
That's good. But
Yeah.
I thought you were doing it. Okay, so this.
I can do the video.
Okay, yeah.
So we're gonna do a quick video and then we'll come back to this. They'll explain a little bit about the by name list and what we're doing with the by name list.
Cities and counties are solving homelessness by changing the way they tackle the problem. What was once thought to be impossible is now possible. Built for Zero is a national movement of communities ending homelessness one population at a time. They are coming together around a shared vision of not just helping those people, but driving homelessness and community. These communities understand that people may be vulnerable to housing crises due to structural and system forces, but they can create local.
Sorry.
Somebody is coming.
Homeless responses that ensure fewer people are experiencing homelessness. It takes a radical move. These communities know everyone experiencing homelessness by name and around time. They are testing new ideas to address the ever-changing nature of the problem. They use data to understand the changes in address should be implemented. These communities are demonstrating that ending homelessness isn't just a noble aspiration; it's an achievable reality.
Yeah, let's come in quick.
So that's essentially just a summary of the functional zero approach that we thought would be fitting to use, particularly with these fathers. And so there are 10 steps to implementing the functional zero approach. We're not going to read through all 10, but we'll talk about how we implement it, the steps in our research project.
Cities and
All right, so typically we'd have our sister Lisa here, she's online. Hey Lisa, good to see you online. And but when we talk about the Rush Project, we're laying the foundation of what we were going through in the beginning to make sure we can do our research the right way. And we'll talk about the team that we have and everything, but the goal was to end homelessness for fathers in Metro Atlanta. And when we think about fatherhood, there's different gaps in in all systems. That's why we're here. We talk about the different challenges that fathers face, the things that they need to overcome, the bias that's already there against fathers. There's so many different things. And so as we're looking at our objectives, we want to identify strengths because even though there's gaps, there's also strengths. We want to make sure that we know the assets that are out there, and then knowing how to improve the system or get into the system and make sure that we can have access so we can influence what's going on. We want to make sure that we were identifying fathers that are experiencing homelessness, and for us, it was in a specific area, and then examine the feasibility and acceptability of adaptive systems and an alignment approach. And that's what we wanted to do. Is how do we align? Because if you and I help fathers, but we don't know each other, then can that father get all the resources that are available to him? Probably not. There's a disconnect often when we're helping a father out and they need support, they need help, and we have this disconnect. So how do we align all systems together so we can have a better approach to supporting our fathers? And so, as I mentioned, we had a community. I skipped them. Okay, yeah. So we had a community approach to this, what we were doing, and so these are our medical and social service and public health partners who are part of understanding this system. We had a chance to interview these partners in our coalition to find out what they were doing to support fathers that were custodial fathers in their systems. When they come to their doors, what kind of information are you gathering? And so if we're looking at ending homelessness, then we want to, find out what the organizations and agencies were doing to support fathers in the space. So we had these individual organizations, agencies come and be a part of the research that we were doing, and we were able to talk with them. Do we want to talk about that now? It's coming up. Right? And so as we look at that, we also had community members come and get this with them. So we had community members who were part of engaging in solutions for fathers. And we had their input into our research so we know that we're heading in the right direction in the research that we're doing. It was important to have all this feedback within the framework of our research so that we can really find out what's necessary and needed for the fathers that we're supporting.
All right, so as Thomas starts to talk about, we did see some interviews with each of the partners to understand, what are some of the ways that they connect with fathers, what are the kind of processes that they usually take when they identify housing as an issue for any of their patients or clients, just so that we can understand where can we apply this functional zero approach, what will kind of help to support it in their routine, because these are busy people. We all are busy. And so if you come to them and say, we want you to do something new, we want you to do something different, it's automatically like, oh, I'm already overwhelmed, I already got stuff to do. So we really need to understand what are they already doing, so that there are ways that maybe we can tailor and adapt their current processes to make sure that they're identifying these fathers and referring them services, so that it's not something that, is another thing to do, but it's a part of what they already do. And so we had these interviews with each of the partners. What we came to understand is that across the partners, there's a lack of data, particularly about fathers. They may have information on demographics in terms of race, in terms of age, gender. They can pull that, but is this individual a parent? Does this person have children with them? Blah, blah, blah. They aren't really able to pull that and say, which is interesting. They also didn't have a lot of intention around serving and documenting services to fathers. And so when we say intention, the common saying was, we serve everybody. Everybody that comes in, they go through, this same process. We're not looking at anybody differently, so we can't really tell you if fathers are served versus anybody else. And it's like, okay, all right. I mean, that's maybe cute, but it's like we need to go understand this particular needs of various populations that are being served. And so if you just kind of aggregate everybody gets the same thing, that's not really effective. And so we found that that was kind of a common saying, but they also said that there is a need for a comprehensive referral and tracking system, as well as staff that can help, with that referral and tracking. And so that's where we concentrated on, that we needed to put some system in place that all of these partners would be able to refer these fathers and be able to get them connected to the resources, particularly housing.
And there was another kind of assumption that could be made is that even though there wasn't a lot of father data, there was a lot of data on other groups. And so there's a general aspect of what people were, the type of support that they would give. But when we think about mothers with their children, obviously there's a lot of other shelters out there for mothers and children. And so in order to get people from the mothers and children to these shelters, there have to be questions that were asked. Those similar questions aren't there for fathers. And so I want to add that and then get good at this eventually.
I don't know. But one of the barriers that we found was the actual definition of homelessness that a lot of the agencies took. And you literally had to be on the street or, sleeping in a car in order to access some of the services through coordinated entry. And that's not always the case for folks. Sometimes people are homeless in the sense that they don't have a place to call their own. They may be staying on a couch. They may be staying, with a friend, but it's not their stable place. And so we expanded that definition of homelessness as far as individuals who could participate in this study, and looked at individuals who lacked a fixed, regular, or adequate residence. So that didn't mean that you were just on the street. If you were not in a residence that was regular or stable, that kind of qualified. But we also included those other definitions about, you're in a shelter or you're residing in a public place.
And when you think about homelessness, if someone can kick you out of their house immediately, you have no right to that house, you're technically homeless. If you're sleeping on someone's couch and you're couch surfing, you're technically homeless. And so a lot of fathers find themselves in that situation where they're doing whatever it takes to get to the next space and move forward. But there's this technical idea of homelessness that takes place.
Yeah, question. Go ahead. Yes, we have a father we're trying to help right now that's staying in an extended stay. This is heavy. It's a lot. It's hard to not be able to immediately meet that need. So
So when we start thinking about the criteria for this research, we had to narrow the criteria down quite a bit. And so we know that there are many homeless individuals, men especially, that identify as African American, Black and African American, especially in the city of Atlanta. So you have to be 18 years older custodial father. Now, what we decided to work with is not just custodial, like you have your children, but it's the support we're going to give to you. Will it help you gain more access to your children? Will it help you to engage, have a place where your children can come to you and spend time with you, even if you're not going to have them all the time? Does it allow us to allow you to reconnect with your family, your children? And so that was important for us, because when you start thinking about how, when it comes to fathers and being custodial, not every father is going to pull their children into the streets with them. They'll allow them to be in different spaces just to try to get themselves together. And so the other criteria is live in the city of Atlanta. So Atlanta is huge. The city of Atlanta was important for the resources and the partners that we have, so that we can focus in on what everybody was a subject matter expert in Atlanta regarding father homelessness, and then meet the definition of experiencing homelessness is what we just went through. So being able to conduct these interviews and allow us to engage fathers in this space allowed us to begin that process of how we're going to move forward with this project. So we're setting the parameters of the research, but there's a way of moving forward with what we're doing. Okay. Wait a minute. Switch it here. Slide. Okay. So what we started off embarking on doing, we wanted to create a system that allows this linkage to take place between providers and for service providers, support providers, medical providers, that we can all communicate around the individual, a father. And so as we started to look into creating the system, we didn't want to have to recreate the wheel if we didn't have to. We did plenty of research and we came up with Unite Us. And Unite Us is a national platform, but it at Unite Us Georgia is where we're at. And we found that there were a number of different agencies already connected with the Unite Us platform. And in doing this Unite Us platform, we were able to get the data infrastructure that we needed, where we can now connect our service provider partners on this platform and be able to refer out. The good thing is it already had a number of different resources for us that we can now connect with our fathers that we didn't before have, but also to start creating our father network within this space. And so it was it was easy for nonprofit organizations. They give a free license. And so for our nonprofits that are a part of our strategies, they were able to go in and start to sign up, engage, and then create forms. And so now we have a number of different agencies that have referral forms that they can just go in and they click on our website, need support. They begin to put their information in. It goes into the database. The database prompts us to connect with this person. We connect with the person. We find out even more needs. It also allows the person to sign up, give consent immediately. We don't have to go through this whole consent process. They go through, they're able to walk through the process. The other thing is this database has over 700 different outcomes that they can provide back. And so we found that Unite Us was a really strong tool that we want to begin to look into to see how we can begin to support our fathers. And as we're moving through it now, we're able to, again, start to build our network within it and also track the fathers through the process, connect, refer them out, also follow up with the person we refer them to, allow the person that refer them to communicate back with us. So now there's this communication that's taking place and the true wraparound services for the father. And so our intake form is pretty simple, and it's about finding out more information because as we noted earlier, a lot of the information about the father was not captured. So we want to make sure in this process that we capture the information from the father, so their personal information is important, their homeless information is important. Parenting status, support resources, and consent forms. So as they're walking through this process, it's really simple for them. It's not something that's intimidating. We want to make it as simple as possible. And we don't even ask, they're homeless. So what's your city that you live in or the zip code? But the reality is you don't have a city or zip code. What do you have access to? So that's what we want to do is create access through this system. And the United platform, they're very helpful in supporting what we're doing. We've taken times. I didn't touch it. See, it's its own thing. I'm telling you, when you have to come up here, we'll give you a lesson on what not to do. But the reality is, when we start to think about how we engage with fathers, we have to begin to see the different situations. Let me find out where we're at with it, because we just jumped.
So at any rate, we did the intake process, developed that. As fathers were going through and refer to us, we also asked if we can do an interview with them to understand their experiences, how things were working for them, et cetera. And so, like I said, this is heavy because, some of these fathers were just looking for housing for a long time. We had dads who were looking for housing since 2017, haven't been in a stable kind of housing situation and continuing to run against different barriers. Frequently, the fathers were saying that they, were seeking assistance just so that their families could be together. So sometimes, like Thomas said, the children are staying maybe with a family member or they're staying in another place so that the dad, basically the kids can be good and he'll just figure out. But anyway, I'll just go through some of the themes from what the father shared in terms of experience seeking help. A lot of times, like I said, they run up against a lot of barriers. It's been frustrating. They're trying to do things for a long time. They may get some access, they may get a win, and then things fall through. We had a father to get a housing voucher, and then funding for the program fell through. So it's like, 2 steps forward, 2 steps back, just kind of constantly doing that.
And in the beginning, when we were starting our research, we connected with the Atlanta Housing Authority, and they did say that they'll provide vouchers for the fathers. But in the same breath, they said, but we have mothers and other people out here we cannot find housing because there's not many affordable housing options for just those. We have a backed up list of people who are getting vouchers. So that was one of the barriers up front. And even if, through partnerships and getting vouchers, there's still challenges.
They finding that some of the landlords and property managers wouldn't accept the vouchers. And they weren't enough money. And so again, we're learning about the various barriers that the fathers experience. We asked them what things were helpful. Of course, maybe this is social desirability, but they did say we were helpful. But they also said church, was helpful for them. But they were having a hard time because they're still in this situation. So it was hard for them to even identify, like, have I really been helped? How can I really say it if I'm still in this situation? There are also, we asked the dads about some of the reasons why they avoid seeking assistance, because we understand that, from the numbers that are in the homelessness management information system, that's an underreport. Most fathers are not going through coordinated entry. In fact, we asked them, have you gone through the coordinated entry system? And most of them will say no. So we send them back, because we want them to go through the full process and have access to all of the resources that are available. But a lot of them didn't even know what that was, or any of that. And so I have a quote. Next slide, if we can go through it, that explains kind of what one dad was saying about his experience. He says, you don't think you are ever going to get help. You sometimes come in contact with a couple of bad agencies that don't do too much for you, which discourages you. And it's hard for men to believe that there is assistance for males, and they don't believe the system is going to work for them. If you don't fall into the categories of being mentally ill, a veteran, a drug addict, or dysfunctional as a male, it doesn't seem like there's hope for you. And this, rings true. We, like I said, we have a father and family who are staying in an extended stay, and he was told, well, we only help people with justice involved background. So he's like, okay, I don't have a clean record. I'm just trying to get, housing for me and my family. So it just, yeah. So anyway, this just kind of lifts up a lot of the barriers that fathers are experiencing.
So even in normal life, we get discouraged by different things. Rejection is not something people want to hear. If you're constantly rejected, going through a process, through a system, it's going to discourage you from continuing to find that. If someone can't help you immediately, you're going to move on to the next thing. And that can be a problem in itself, because we don't get a chance to work with this person because they've been traumatized through the system of not getting resources. And so as we're engaging them, they disengage because it's not immediate care. It's not the immediate support. So sometimes we got to help them to understand that this is a different process. And that's one of the barriers that we experience.
But I think, like I said in the beginning, with this by name list, it's about not just numbers and just trying to, move them through. It's about, understanding them fully as a person and bringing them into this community, particularly a Fathers Matter ATL, making sure that they understand, okay, maybe we don't have your housing situation correct, but we can help you with these other different things, these other different resources that are within our network, and just staying in touch, keeping them updated, letting them know, and letting them keep us updated too of what's going on with them and where these various referrals are. So it's important to not just disconnect because they weren't able to get the first thing to work, but to keep trying and keep working with them. And we also asked our partners, once we got this Unite Us Georgia system up and running, what was their feedback, and so luckily, like I said, we had our medical care and social services partners that were using the Unite Us system, so that made it easy for us to be able to connect and send referrals. They agreed that system is better than what they were previously using in terms of sending referrals, and it's user friendly. Our coalition members, again, which included those fathers who experienced or are still experiencing homelessness, and those fatherhood program leads, they also agreed that this project will be successful. So that's continuing to encourage us to stay on this track. It is hard work, but continue to stay on this track to see what we can do to alleviate these barriers for the father. So some of the partners gave some quotes. The partner said, Rush is the only system of its kind that's tailored towards active fathers who choose to be head of the family, a system that will help Black fathers have the courage to ask for help. And then one of our healthcare providers said he looks forward to identifying and testing these novel methods to identify fathers experiencing homelessness in our healthcare facilities. And once identified, having effective resources with which the client can be connected. And so this project is funded by the Robert Wood Johnson Foundation, their Systems for Action initiative. And so, yeah, so that's essentially the project. So we'll open it up to you all if you have questions, if you have comments, if you have common experiences with trying to, address some of the housing needs of fathers in your communities. It would be great to hear.
While we're looking over this, I just want to say, when you start to think about the complexity of what we just presented to you and what we're talking about and through research and partners, and imagine an individual father going through this, wanting to care for their child. So solutions have to be at the end of what we do. This is not just research for research sake. This is research that crosses over state lines. It's what we all experience. It's understanding that fathers matter, right? So we have to begin to think about the fathers and fatherhood in a different way, where it's not just mothers being left out in the cold, but fathers find themselves in different situations. In the climate we're in right now, as far as jobs, as far as how work is and the affordability of everything, it seems like, yes, we're getting higher pay, but everything is going to adjust to that pay. And so it's just going to balance out, keep things status quo. So over here, we can celebrate success of higher pay. But behind the scenes, there's still a group of individuals and people who just need to understand the process or find the wraparound support. So some of the challenges that people face, the mental health challenges, the crisis that they may have, or uh, trauma, the children's needs, the food to eat, and just shelter in general. There's so many different challenges. So I want you to reimagine like a system that where we're all communicating together, where a little bit can be done here, a little bit can be done here, but we're all working toward the same thing. And the main thing for a lot of these individuals is housing. Can we get you into a housing position? So now that we can turn around and provide the additional support to you, and you can receive that support because you're not worried about where you're going to lay your head for tonight. A lot of times that can be a bigger challenge, and through our research, that's what we found. We found that uh, as we're addressing the housing aspect of things, there are other resources that we can provide, like jobs, job training, food, uh, clothing closet, and food pantries. And so, just different things. But not only that, now how do we get you to be able to grow and sustain this process, not just coming in? Yeah. So there is room for expansion, but in the beginning, we want to make sure that we have a good system working. So the United system would probably be located where you're at with resources already, which then allows us to really expand to other areas. So once we get the methods down and the methodologies, then we can begin to engage differently. We can engage different cities because there's different needs in different cities. So with the city of Atlanta, we're understanding the barriers that we're facing right now. We're understanding what works, uh, how many different resources are out there, how we can connect and make sure to ensure that the fathers are being cared for and their children. Start resources, different other resources that are going to be necessary, needed. So what we could, eventually do is do an asset uh, study in other areas, find out what assets are there, and then connect them to the system. And then Fathers Matter ATL, what we talked about, brings a number of different organizations together and 7 different strategies. What strategies need to be in your community? So even though this research started last year, Fathers Matter ATL is 3 years old now. And so we convened 3 years ago, a number of different organizations on the Zoom call, and it's built out to where now we have, changing the narrative, addressing mass incarceration policies, and so many other areas that we begin to engage and aggressively see if we can begin to make shifts and changes. So this housing aspect that started last year is something that we're building, and we want to do it right. And so that when we do, and again, we can partner because we have other organizations in other cities across the country, and partner and see what we can do to help support growth in your area for this. Okay. And I love how you said that. Nashville's here, Chattanooga's here. They're 2 different types of city, but you're right in the middle, and it's kind of a, yeah. Right.
Especially, yeah. That primarily. Once they got out. That's like, yeah. Over to the transition their children. So it's a good program.
What kind of resources do you think would be needed here?
The thing about it is, for people to make a job that chart. Well, I mean, I think it's an issue where I think you find like you're doing that, right? Like authors, very adaptable, very easy, and I mean, that's really making one. That's what you're doing. I think that's great. So when you guys get in Atlanta, able to expand.
And that's the importance of the data, is to see that in Atlanta, this is a problem. And then we can expand the research and the scope of the data to other cities. And so to find out what the barriers are. And that's one of the beauties of this study, and I love it, is that we found out what barriers are there. We didn't just make assumptions, because we can make the assumptions. Now we have the data to show that fathers are not identified, especially when it comes to fathers with their children who are experiencing homelessness. And so they need to, there's more inputs that need to happen so we can address father needs in a way that can help them when they're in bad situations. You know, it's not that every man is out there making bad decisions, and that's the only reason why you're homeless. Not that. It's not that every woman, I think everybody needs to be cared for. Let me say that. I just think that there needs to be a level of care for fathers that matches that care for mothers. I think that's what we do with the College Matter ATL.
Life coaching. To be able to see now go back to the you know effort. We were
Absolutely.
the just to ask the question, do you have children? Sometimes they're not even at, we had to have them pull, like, disaggregate this data, pull it, find, where was a father included on a case with a child, so that way we can understand how many fathers were going into the homelessness management information system. It's not readily like pulled. They even told us recently, like, we had to have somebody do some special, like, prompting and creating code to actually pull that data. It shouldn't be that hard. Like, it should just be a general question, but they're very quick to pull up, well, 8% of our clients are women. How 8% of our clients are mothers? How come you don't know how many are fathers? They don't ask. So to rectify that is to ask the same questions and to make sure that when you're assessing men coming in, ask them.
Yeah.
Absolutely. Yeah. And that's justified. I mentioned that in a previous presentation that we understand this is an underreport. We understand that there's hesitancy in being honest, particularly, if you kind of having your children stay somewhere else so that they can be safe, and you may not want to share that your children are somewhere because you don't want them to take your children.
Right.
And so we understand that there is that, that can happen as well. However, when we as professionals are coming and we're saying, can you help his dad? There shouldn't be all this, all these barriers. It should be, oh yeah, here's the resource. You can do this. And
So that even the data that she talked about, they had to jump through all these hoops and get to the point where they can pull the data for it. You have to stay on top of that, because even the person who did all the hoops and everything else to get the data for us, the next time we would back to get the data, it wasn't there. But now we have to talk to a whole other group of people who have to try to figure out how to pull this data out different way. With our service partners that were on there, medical providers and all those, we have conversations with them. And we ask them, can you begin to make these questions available to the people that come through your doors? And they agree, but we still definitely need to follow up and make sure that, we're able to capture that data, because it's a simple question sometimes. And if those questions aren't being asked, then we cannot capture the information that would possibly support a father going through the situation. Yeah.
there's a couple of questions in chat. Someone asked about the age of the fathers. Fathers are a bit younger, or
They're usually around the 20s. I would put them mid-20 average. And the one that come through, I know there's 30, But correct, low thirties is the oldest we've had. But most of them are, younger fathers with 20 and 30. Right? And it's important because a lot of times, they have small children. These fathers come in with these small children. They're trying to figure out themselves. They have barriers that they're experiencing. They have life happening. There's a gentleman that just came through the program. He's experiencing homelessness. He has two kids by someone else that's causing problems, and then he has the kids that are with him, and then his mom dies at the same time. And you have all these barriers that happen. And we're just trying to help meet the needs of the person. We're not trying to give you something, but if housing is a challenge, then it's housing first. Once we get the housing taken care of, let's see what happens from there. We're going to give you resources that you're going to have to work through. Hopefully, you can work through a process that allows, that's high touch, high engagement, and able to help you have sustainable housing for the long run.
Someone online gave another great suggestion about not just working with the medical care, social services, and public health, but looking at schools, looking at other kind of settings, non-traditional settings where fathers may be experiencing homelessness. And so we did get that comment when we presented before, and that is a good referral for us as well.
Working with feedback,
Yes.
places like that,
Yeah.
state agencies, and so definitely going to expand the work. One of the things we're applying for another round of funding that will allow this to go 2 more years out, and it'll give us more resources to really engage and build upon what we've already done. So we're in the process of doing that now, and if we're able to do this, strongly believe after 2 years we'll make a significant impact in fatherhood homelessness, because we'll have the systems in place that we get to work with from the beginning. The last part of the research, we're doing research and we're looking for a system that can meet the needs. So a lot of it is the research, is finding things out, it's, doing all of the things that are necessary. And then when we finally get the system, now we have to learn to implement the systems and everything else. And so we're ready to go on the next round. Should we be funded or when we are funded? Say that. When we are funded, we're going to be able to hit the ground running with this.
For this particular project, but generally, yes. Yeah, generally for Father's Matter activities and things like that. There's a question: how do you make men not feel threatened about getting hit up for extreme child support issues? So I think a lot of that goes back to the partnerships. They've already connected with the fatherhood program or something, and feel trust there, and then they're exposed to us. We're not connected to child support or anything like that. We're not referring people to child support. We're just trying to meet the housing need. So, and we're not getting social security numbers. We're not getting potentially flagged, whatever. So, we do, share that we're just trying to help. So,
And again, men will feel threatened because they've gone through the process. They feel unsure, if I make this move or this step, will it trigger something over here? And so we're just trying to make the process as harmless as possible.
and transparent, we're
Very
transparent, all involved. Question back here.
Just for now.
Yeah, I think we focused on Atlanta because each county has its own coordinated entry continuum, so each center. And so Atlanta has it's partners that focus on coordinated entry. If we were to talk to the CAB, we have to go to a whole other agency. We also, because of this grant, have to have a public health partner. Those are county-based as well. So it's like, let's just focus in on one area, test with the one area, and then see how things go. I don't think that is, as Thomas was explaining to our partner in Tennessee, I don't think that it's any different. Whoever we're going to share this model with, the functional zero approach has been used in a number of different communities. Happy to share this presentation. It's on YouTube 2 times now. So if happy to connect. If you would like us to just talk with your agencies to share what we've learned so far, happy to do that. But this isn't a process that's ours, so to speak. The functional zero process is national and things. So
the systems and everything else we're willing to share.
Yeah.
I mean, we're not trying to hold this back from moving anywhere.
United is not ours. United is a national platform.
The national platform. So we just want to make sure we have a structure that engages fathers. So we ask the right questions to the partners so that they can begin to serve fathers well. And so as we begin to learn the systems that need that input and engagement, that's what we want to pass on to you all, because it's important. It's probably the same here in Los Angeles, where it's a very large city, but there's different ways to engage the system of finding out how the homeless population here has boomed the last 4 years, and pretty sure if we did some research here, we'd find that there's a lot more custodial fathers, or fathers that are living on the streets and their kids are living somewhere else. That would probably be true here also. So it's just important that we make connections, and that's why I got to throw this slide back up. It's at the bottom, all the way to the bottom. So we're going to go here to the connect slide, and I want to make sure that we all connect. And see, I went too fast.
Turned it all the way off.
All the way off, but we'll be back. Give me a second. So, want to make sure we stay connected, and that's the important part. So, and there, you all have our contact information. Let me make sure we get our people back on the Zoom call so they can see it, so that we can stay connected. And look, it did it the right way this time.
At the end. I'm gonna provide my shameless plugs for my center if I can.
Yeah.
So we have a community pilot project with the African American Child and Family Research Center. If you are a community-based organization that wants to conduct your own research, we do have a pilot project where you can apply for $20K. We're going to be giving that to 3 organizations. And scan the QR code, it'll take you to more information about that. And the application deadline is June 21st. We also have a conference in Atlanta, which is focused on community engaged research. So we're be sharing various research collaborations, lessons learned, and community engaged research approaches. It's free. It's also hybrid. So if you, for whatever reason, don't want to come to Atlanta, I don't know who doesn't want to come to Atlanta, but if you don't want to come to Atlanta, you can also get it online. So just want to plug those.
So again, if you need to see those QR codes again, $20K. I messed that up. So the pilot project program, one of the things that you all can be a part of. And again, there's a lot of different information. So collaboration is important to us. When we first started talking about CPR, is participation from the community is important. The participation from collaborative organizations, different cities. We're willing to connect and do what we can to support what you're doing, learn from you also, share our findings that we have, because this work is huge. When we think about the conference, you want something that's greater than yourself. All to something that's greater than yourself. Looking to end homelessness for fathers is something that's greater than just one organization, one research project. It is something that needs to be ongoing. It's something that we need to find different resources for. We do know that there are many different opportunities out there to create housing situations for fathers. But until we see that the need is necessary and needed, it's going to be hard to find resources that will open those opportunities up. So if we create the needs, and as the person was saying earlier, deal with the mental health challenges, the different challenges fathers may have, being able to put that together as a solution and a source, change and transformation. Once we're able to do all that, then we're able to engage fathers at a higher level, higher plane. This moves forward, but it starts with understanding where we need to start. And that's what the research is about. Right, I think we are almost that time. I can't see the clock here. There we go. 2:04. So, yes, you all have any more questions? We're here. What part of Los Angeles are you in? Okay. Yeah. All right, you all.
Thank you all so much. Yeah. Yeah, both of them.
Yeah. The second one has to make
Has the
that
intake.
support. Thank you, everyone. Join us. Have a great day. See my people out there. I see you. All right. Appreciate that. I found you on the third, but I said chill, that's it. Okay. I find it as well, but I think you have to support the library. Kind of guidance, like you said, even using the model and partnering up with the council here to see what we can do because
It is.
we love making sure that people get a head start. Yeah. If there's anything we can help you get a head start, it'd be great.
Still learning, but we can share what we learn.
Likewise. Let's say you too, sir. Nice to meet you. All right.
Taking your advice.
Well, no, that I did it.
Oh.
And then the next person. Yeah, let me see your computer. Let me you on.
Our picture run.
All right, y'all. Thank you.